Welcome to the Dermatology Studio with Dr. Yusra Ayaz.
All right, today we are doing a deep dive into a skin condition that is incredibly common, but man, is it often misunderstood. We're talking about seborrheic dermatitis. You know that stubborn dandruff or the flaky red skin on your face that just refuses to go away? Well, if that sounds familiar, this explainer is definitely for you. We're going to break down everything from how you even get a proper diagnosis all the way to building a long-term management plan that actually works.
So, here's our game plan. First up, we'll nail down what seborrheic dermatitis really is. Then, and this is a big one, we'll look at all the other conditions that look just like it. After that, we'll peek inside the doctor's toolkit to see how they confirm a diagnosis. We'll also cover what to expect long-term, and then we'll wrap up with the whole management playbook. Sound good? Let's jump in.
So, let's get right to it. What exactly is seborrheic dermatitis? Well, at its core, it's a chronic inflammatory skin condition. And that word chronic is key. It means this is something you manage, not something you cure with a one-time fix. We're talking about redness, flaking, and itching that tends to come and go, usually popping up in areas with a lot of oil glands. Think scalp, face, chest, that kind of thing. Now, this is where things get a little tricky. Seborrheic dermatitis is a bit of a master of disguise. Seriously, it can look like a whole bunch of other skin conditions. And that's why getting a professional diagnosis is absolutely crucial before you start trying to treat it. So, let's pull back the curtain and meet some of these common lookalikes. And wow, just look at this list. It's like a police lineup of skin conditions. Psoriasis, for instance, it's probably the most common mimic, but it usually has these thicker, silvery scales and really sharp borders. Or take allergic contact dermatitis. That's usually triggered by something specific you touched, and it is intensely itchy. Then you have something like tinea capitis, which is a fungal infection, and it can actually make hair break off. See? Each one has its own little telltale signs that a dermatologist is trained to hunt for.
And it's not just adults. In babies, seborrheic dermatitis is what we call cradle cap. But just like with adults, there's a totally different lineup of conditions that can look shockingly similar. And getting the diagnosis right in infants is so important, because some of these mimics can actually be a red flag for more serious issues that need to be addressed right away.
Okay, check this out. It's a perfect side-by-side. On one side, you've got this greasy, kind of yellowish scales of cradle cap. That's classic infantile seborrheic dermatitis. But then look at the other side. Psoriasis in a baby often shows up as these really well-defined angry red patches with silvery white scales. You see it a lot in the diaper area. It's these subtle visual cues that a doctor uses to tell them apart. And this right here is a perfect example of why getting that diagnosis right is absolutely critical. Liner's disease can look just like a really bad case of seborrheic dermatitis, but it is a much more serious systemic condition. We're talking about a weakened immune system, constant infections, and it can even affect a baby's growth. It just goes to show you can't just guess with this stuff. So, with this whole rogues gallery of lookalikes, how in the world do dermatologists actually nail the diagnosis? Well, they've got a pretty cool diagnostic toolkit that lets them see what's happening both on the surface of the skin and underneath it. Let's take a look. This is where the tech gets really awesome. A dermoscope is basically a super-powered magnifying glass with a special light. It lets doctors see the tiny patterns in the skin. With seborrheic dermatitis, they'll see these branching, almost tree-like blood vessels. But with psoriasis, it's a totally different pattern, just a field of uniform red dots. It's like looking at two completely different roadmaps, and it's a massive clue for telling them apart. But sometimes, even with the dermoscope, the picture isn't perfectly clear. In those really tricky cases, the next step is a skin biopsy. It sounds scarier than it is. They just take a tiny little piece of skin and send it off to a lab to be looked at under a microscope. And that's where they can see what's happening at the cellular level. So, under the microscope, one of the classic signs of seborrheic dermatitis is something called spongiosis. I want you to picture a brick wall, right? Now imagine water seeping in between all the bricks, pushing them apart and making the wall look kind of spongy. That's pretty much what's happening to the skin cells. And seeing that spongy appearance is a huge check in the seborrheic dermatitis column. And then you get this term, which is just fantastic. The squirting papilla. It sounds dramatic, and it kind of is. It's a very descriptive name for what's happening microscopically. You've got these inflammatory immune cells basically squirting out of the tiny blood vessels and into the top layer of the skin. When a pathologist spots this, it's another really strong clue that they're dealing with seborrheic dermatitis.
Okay, so we've seen how the diagnosis gets made, but what does it actually mean to live with this condition? Let's talk about the typical journey, the course it takes, and some of the potential complications that really underscore why good management is so important. This is probably the single most important thing to wrap your head around. Seborrheic dermatitis is chronic. The goal isn't to find a magic bullet that cures it forever. The goal is management. It's about finding a long-term maintenance routine that keeps your symptoms under control and flare-ups to a minimum.
You know, this is so much more than just a skin condition. It can have a real, tangible impact on your quality of life, on your self-esteem, especially when it's on your face. And studies have actually linked it to a higher risk of other health issues like depression, anxiety, and even things like high blood pressure. This is why taking a holistic approach to managing it is just so essential.
All right, let's get to the good stuff, the part you've been waiting for. The management game plan. The great news is there are a ton of effective treatments out there. The trick is just finding the right combo for you. So let's walk through the options, starting with the simple stuff and moving up to the more advanced therapies.
So, doctors usually think about treatment like a ladder. You always start on the first rung with the gentlest, most common options. If those aren't quite getting the job done, you climb up to the next step. The whole goal is to find the most effective treatment with the fewest possible side effects to keep things under control for the long haul.
So that first line of defense, your go-to treatment, is almost always a topical antifungal. We're talking creams, shampoos, lotions, things you put directly on the skin. Ketoconazole is a really common one, and it works great. And you'll probably recognize ingredients like selenium sulfide and zinc pyrithione from famous dandruff shampoos. They all work by knocking back the amount of yeast on the skin, which we think is a major player in driving the inflammation.
Now, here's a really important pro tip. Not every treatment is right for every hair type. For people with more fragile, coily, or chemically treated hair, some of these medicated shampoos can be incredibly drying and can actually lead to breakage. In these situations, it is so much better to talk to your doctor about other options, like ointments or foams or oils that can get the medicine where it needs to go without stripping the hair.
Next up in our toolkit are the keratolytics. Think of these guys as the cleanup crew. Their whole job is to break down and lift away all that thick scale and flakes. Not only does this make the skin look and feel better, but it actually clears a path so the other medicated treatments can sink in deeper and work way more effectively. You've probably heard of some of them, like salicylic acid and urea.
Okay, when the redness and the inflammation are really the main problem, we have two big players. Topical corticosteroids are fantastic for calming down a bad flare-up really fast. But, and this is a big but, they're not great for long-term, everyday use because they can thin the skin over time. For sensitive spots like the face, topical calcineurin inhibitors are an awesome alternative. They fight inflammation in a different way, and you can use them for longer, though you might feel a little stinging when you first start. But what happens when the topicals just aren't cutting it? For those really severe or widespread cases, that's when we bring in the heavy hitters, systemic therapies. These are things like pills you take or medical light therapy that affects your whole body. Oral antifungals can work wonders, and so can phototherapy. These are definitely reserved for the more significant cases and always require close supervision from your doctor.
So at the end of the day, what does winning look like with a chronic condition like seborrheic dermatitis? It's not about a single victory. It's about collaboration. It's about creating a personalized, sustainable, long-term playbook with your doctor. It's a journey of finding what works for your skin, making adjustments when you need to, and just staying consistent. Because by being proactive, you really can keep your skin healthy and, most importantly, not let it get in the way of living your life.
Thanks for watching. Hit like, share, and subscribe to the Dermatology Studio. Ask your skin queries in the comments below.